Hi. So I thought I'd come on and give you an update. The update is that I've had a virtual meeting with Dr. ROZBRUCH and MUNJED from Australia. I was so very blessed to have a virtual meeting with the two of them together. They pretty much put their heads together to determine the basic procedure that they thought would be most advantageous for me and my particular case. So previously in other videos, I explained with the gentleman from Baghdad who had his leg removed and the implant through his pelvis. And that is how the previous patients have undergone this particular procedure with losing their entire lower extremity from their hip down. Due to the treatment that they received and the results or outcomes, these physicians in these areas of the world, whether it's HSS or it's in Australia, they very much study their patients and they study the treatment and the outcomes and what they can do to improve or better. Not that other physicians do not, but HSS is a teaching hospital and they have a lot of staff, residents, interns that's pretty much a major part of their job and a major part of their education is to study the treatment and study the outcomes. And then all of them together collectively to make suggestions on how to improve various procedures. So with Dr. MUNJED and Dr. ROZBRUCH looking at my case, looking at my films, and putting their heads together, and after about, about an hour or so time, they thought it would be advantageous to keep a portion of my femur. And why would they keep a portion of my femur? And that was a big question for me. Like, why would you do that? I'm not going to be able to sit. I'm going to be sitting crooked. I'm still going to have that issue. And that's a huge issue because anytime you sit, for me now, I sit crooked. And in order to sit upright, I have to adjust my back, as I've explained in previous videos. And so I was really pushing back really hard on that thought because I'm very concerned about how long the femur would be and would it impact my ability to sit normally. So in a technical sense, it wouldn't be, in their opinion, they would make sure that it would be short enough, but yet long enough to accomplish what we need. And there are two pieces or two important reasons why to keep part of my femur. One is that I have osteopenia, which is a thinning of the bone. Mine is due to the long-term inability to put weight through my leg at a significant enough rate that I didn't lose bone. That's why exercise is so important, because it maintains the health of your bones. Because I have such dysfunction in my lower leg, I can't bear weight or much weight on my leg. So I have disuse osteopenia. Keeping part of my femur would allow there to be more bone for the metal implant to go through and therefore my bone to attach to. So that's one reason. The second reason is that in previous patients that have had their entire extremity removed and an implant put in, is that the bone that the implant is coming through doesn't come right to the edge of the skin. There is soft tissue that extends past the bone, and then the implant has to go through a fair amount of soft tissue. And they have found that to be problematic. So in my case, if they leave part of the femur, it'll give me more bone stock. And two, it'll bring the bone right to the edge of the skin, and there won't be a lot of excessive soft tissue between the end of the bone and the end of the implant. So in all other cases, whether it's, they're taking half of the femur, they're taking half of the tibia, which is your shin bone, the metal implant or abutment is right up against the bone. And there's not bone, soft tissue, and then the implant. At the end of the bone is where the implant lays. And that's very important for the reduction of infection, and the soft tissue is then not rubbing on the implant and causing pain and other issues. So having the bone end and the implant end right there with it is important. So this adjustment in this procedure of hip disarticulation is actually huge. Like it is, I don't know that I can quantify how big this is. Had I been, the second or third person that they did hip disarticulation with, I'd be one of those folks that had extra soft tissue and would be dealing with some potentially adverse consequences of that particular procedure. So they've learned and studied that it's important that the end of the implant come to the end of the bone and not have excessive soft tissue. So again, I just feel so blessed to be able to be at this juncture. Will be unknown, but I do feel like the Lord is leading the way, and the timing is such that for me as a person, and with the things that are going on with me in my life, and being a candidate at my age and at my activity level, so to speak, or how I've maintained, that's important. And then just the advancements that they've made already in this short period of time. So I feel just very, very blessed by the timing. Now, towards the end of the virtual meeting, Dr. ROZBRUCH asked if he could see me again in his office in person, because he felt like after having gone through this in a study fashion with Dr. MUNJED, myself, and he, and lots of questions and conversations, he felt like he needed to see me in person. And so I have another trip to make to New York City. And going to New York City is just a thing. I don't know. It's a place, as I have mentioned before, that I had never been before, but I've spent a lot of time there, and my testimony in life was really rooted there. So I don't know, when I have to go to New York or talk about New York, it just stirs something in me. Some of it good and some of it not good. So I do have another trip to make to New York City. And that will be yet another video or two. So this video, I hope to be able to be informative and show you some of the some x-rays and things like that to demonstrate exactly what we're thinking at this point. What is normal, or what has been normal in the few patients that have had this, and now what adjustments are being made to improve the outcomes for patients that would be a candidate for hip disarticulation, osseous integration. So that's it. It's pretty simple, pretty sweet. I was able to meet with the two surgeons together. We had such, I don't know, just an amazing meeting. To be able to for them to not be offended or put off by questions that I have, and to have an ongoing open discussion about very technical orthopedic questions, and to collaborate with the two of them was great. To understand a a lot of what they were saying. I mean, obviously, I've never done operation on anyone, but having cadaver dissection and having studied what I studied, orthopedic medicine, via sports medicine, I have a very clear understanding about exactly what's going on and what will go on and what it will look like from a scientific standpoint. So I'm the patient, so sometimes there's like that internal war in my brain. I think scientifically, and then, oh, that's me. And that's, whew, when I get to the point, oh, they're talking about me, yeah, that's that's a little hard to swallow. But when I can think about it from a scientific thing, wow, that's amazing. And meshing those two things is where I'm at. So still processing, still thinking, what is in my best interest, and is this something that I should proceed forward with? And I'm taking my time. I'm since September of last year that I met with him first. Of course, I was thinking and researching it, a few months before then, but this duration of time, I've really been trying to attain as much information as I can. And if you're in a situation where you have a medical condition and you have the time, take it, because you don't want to misstep. You don't want to do something and not have full understanding. If your physician is unwilling to explain it to you, maybe he can direct you, he or she. If you can get a physical therapist or an athletic trainer or a medical professional that understands the medical terminology associated with your medical condition, then ask. Make sure you're fully informed and you understand the pros and the cons of what it is that you're seeking for treatment. I'm not normally one to say, go on the internet and Google. But if you're going to research on the internet, make sure you're a reputable source. And reputable sources typically in the website or the code at the top when you're typing in would have a .org or .edu. Those sites, .org or .edu, are very valid sites. You don't want to end up on a site where anybody can put information and you're getting half-truths or, untruths being told to you about something. So organizations that are tried and true have .org or .edu because they're education facilities, or they've gone through quite a bit of, they have certain parameters to be able to put factual information on their sites. So just make sure if you are researching for yourself, that you're looking at sites like that, or that you're in professional journals. You can go to libraries and places like that and research what your medical condition is and treatment options for that. And there are scientific journals that will give you the latest data on treatment options for what you're walking through. So don't be shy about that. And I guess I would say, everything is a resource. Your physician is a resource. Other patients, physical therapists. There's just a whole lot of people involved in treatment of various things that collectively you need to get information from all of those patients, physicians, and the medical professionals dealing with it, whether it's speech or occupational therapy, physical therapy, whatever the treatment options are that are medical professionals that support that. I'd be asking all those folks. So far I have spoken with physical therapists, prosthetists, former patients or patients that are amputees. And I've talked to physicians. If I didn't mention that, I can't remember now what I've told you. Scientific journals. I've gone to education sessions. Dr. MUNJED and Dr. ROZBRUCH put on a course for osseous integration. And, so getting information from all these places, you're able to get different pieces of the puzzle. And the more pieces you have of the puzzle and that you actually hold in your hand, you can get a clearer picture. If there's pieces that you don't have, then there's holes. And you can't then get a good understanding about what it is you're looking at. So you want to collect all those puzzle pieces. And you get them from all the entities involved in your treatment or in treatment for your medical condition. Don't rely on one piece. That's going to give you the clearest picture of what it looks like that you're going to be embarking upon. Get as many pieces as you can, and you get that from having a variety of input from reliable sources. So that's my 2 cents on any medical condition. How do you make the decision on what to do? Gather the puzzle pieces and create a picture, and that will give you a path of which way to go. All right, so until the next time, have a very blessed day.